Good afternoon and welcome back to the St. Clair County EMA for our daily briefing on COVID-19. I'm joined today by Chairman Kern. Samantha Bierman has the day off. So we're going to get right into this and go ahead and give you the numbers for today. For St. Clair County totals, we have tested 13,050 residents. We have 1,772 positive tests. That's an increase of 24. And those are males and females from their teens to their 90s. We have 11,266 negative tests, with 12 tests pending. And happy to report for the second day in a row, we have no new deaths attributed to COVID-19, so that number remains at 131. For those that have completed their IDPH required 14-day quarantine, we're at 1,319. For the state totals, they have tested 1,336,968 with 136,104 positive tests, which is an increase of 634 from yesterday. Sadly, we have had 6,625 deaths with an increase of 45 since yesterday. For our hospitalization numbers, and those are those that are currently hospitalized in St. Clair County hospitals, we have 35 patients hospitalized with COVID-19 related illness, and 3 of those patients on ventilators. For our congregate living facilities and outbreak status, and as a reminder, that is a facility that has 2 or more staff or residents that are either COVID positive or displaying COVID-like illness, we have the Atrium of Belleville, has 2 cases and 0 deaths. Bria of Belleville has 51 cases and 6 deaths. Bria of Cahokia has 25 cases and 2 deaths. Caritas Family Solutions of Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 4 cases and no deaths. Cedarhurst of Shiloh has 13 cases and no deaths. Cedar Ridge of Lebanon has 71 cases and 7 deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. Four Fountains of Belleville has 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and 0 deaths. Help at Home in O'Fallon has 5 cases and 0 deaths. Knollwood Retirement Center of Caseyville has 8 cases and 1 death. Lebanon Care Center has 55 cases and 10 deaths. Memorial Care Center has 44 cases and 5 deaths. Mercy Rehab and Care Center of Swansea has 2 cases and 0 deaths. New Athens Home for the Aged has 56 cases and 7 deaths. St. Paul's Home has 45 cases and 14 deaths. Swansea Rehab and Care Center has 29 cases and 5 deaths. And finally, TDL Incorporated of Belleville has 4 cases and 0 deaths. Chairman Kern, for your update.
Great. Thank you, Brian. So I've gotten a lot of messages and calls about our friend Herb Simmons. I talked to Herb today. He's doing better. He sounded pretty good. And if he were here, he'd say, get on with the zip code report. And so that's what I'm going to do. Even with Herb not here, I listen to what Herb says. Today on the zip codes, remember, if you don't hear your zip code, it doesn't mean that your zip code is COVID-free. What it means is you haven't risen to the level above 5 people yet who have been diagnosed. So in 62059, we remain at 7. 62201 goes up by 10 today to 62. 62203 goes up by 2 to 58. 62204 goes up by 1 to 60. 62205 remains the same at 67, and 62206 goes up by 1 to 153. 62207 also goes up by 1 today to 102, and 62208 goes up by 1 to 92. 62220 remains the same today at 156. 62221 also remains the same at 150. 62223 goes up by 1 today to 66. 62226 stays the same at 193. 62232 goes up by 2 to 33. 62239 remains the same at 17. 62243 also remains the same at 9. 62254 goes up by 1 to 82. 62255 remains the same at 6. 62257 also remains static at 13. 62258 remains the same at 17. 62260 remains the same at 12. And 62264 remains the same at 54. 62269 actually goes down by 1 today to 93, and 62285 remains the same at 19. So, Brian, today is our 99th day. What are we going to do for the 100th program? Have you got something planned?
I think we should do a question and answer segment.
Oh, hey, that sounds good.
Question and answers on Sundays always seem to elicit good questions, good feedback, a good talk with the panel. Samantha will be back with us tomorrow and able to answer some of those health department questions. And 99 days into this, and there's still unknowns. And I talked with somebody on the page earlier today that had some questions, and it kind of had to explain that with this being a novel virus, the doctors and scientists are still learning from this every day, and 99 days for a virus isn't a lot of time for them to have the good hard facts they need to battle this. So we're still learning every day as we go through this.
And even after all this, 99 days of talking to people and telling to wear masks and stay home and all the things that we talked about, there's still 35 people who are hospitalized with COVID right now in the hospital. That number, although we hope it's on the decline, and the testing number today, I think was pretty substantial.
Correct.
That 577 people were tested, and the positive rate was about 4%. But even given all that, it's still out there after 99 days of all of this. So I think we're going to have this through the summer, but I think we can I think what has been proven is that if you do things right, you can manage the levels and keep them to a point where treatment is manageable, where the hospitals can manage the size of a patient load that's there.
Correct. And with the health department beginning their mobile testing next week, as we announced yesterday, going to Marissa, Smithton, and Mascoutah, and then other communities to come after that.
That's just the beginning. We will be throughout the county, and we're, if your community hasn't been represented yet, contact your mayor's office and have them contact us, and we'll get you on the list. We're working with Southern Illinois Healthcare Foundation, so we'll be able to get this testing accomplished throughout the county.
Absolutely, and it's only going to do good things to help the doctors and scientists understand that. A lot of people ask, why test if I don't feel sick? Well, one, we have seen increasing amounts of asymptomatic people testing positive for this virus, and two, in order for them to study this, they need to see who's contracting it, how it's spreading, those environments. So that's such an important aspect of this that we can't encourage more for people to take the opportunity and get that test.
And you don't have to wait for the mobile. The purpose of mobile testing is for people who maybe have mobility problems, can't get there, they don't have the access to automobiles or bus service or whatever. So you certainly should be out. If you have any question, go get tested. It's easy. We talk about the Walgreens site, the Jackie Joyner site. There's others in the county. They're all fairly simple to use. Access them and take that worry off your mind.
Absolutely. Well, we thank you all for joining us on this 99th briefing that we've been providing on COVID-19. We're going to be joined by Cindy and Daisy here in a few moments to translate this to our Spanish-speaking communities. And until tomorrow at 3:30, we thank you for being a part of Team St. Clair, and we'll be back with that question and answer segment tomorrow. Thank you.